One new survey is highlighting the alarming toll the coronavirus pandemic is taking on Americans' mental health. According to the new data from the Census Bureau, 1/3 of adults surveyed are showing signs of clinical anxiety or depression. Joining me now on Skype to explore these findings is Dr. Cynthia Hunt, a psychiatrist and member of the Catholic Medical Association. Dr. Hunt, welcome to the show.
Thank you so much. It's truly a privilege to be here.
Well, Dr. Hunt, what do you make of these findings and how concerning are they to you?
They're terribly concerning, and this is something that experientially we in the mental health field have been seeing. It's not surprising with stress, trauma, financial losses, insecurity, the multiple changes that are occurring, not being able to have control. All of these things create the levels of anxiety that would be natural. And then many of us are going to be vulnerable to increased anxiety. The incidence of anxiety and depression were rising already. The incidence of suicides, particularly in young people, were already on the rise. Substance abuse, overdose deaths. So we add a pandemic to it, and unfortunately, it is alarming.
Yeah, and 100,000 people have died in the U.S. alone, and tens of millions of Americans are now unemployed. These are very heavy things to witness, let alone deal with personally. Can you talk a little bit more about that?
Certainly, my heart and my prayers go out to those who have been affected by losses from the coronavirus, and those who have been very significantly affected through financial losses, illness. This is very traumatic. In some ways, it does meet levels of the trauma that we see that can result in PTSD. In our patient populations, those who are already suffering with depression or anxiety or substance use are struggling even more, understandably. The stay-at-home orders are certainly necessary and have been necessary, but unfortunately, they also can lead in many families to increased stress, increased depression and anxiety. The domestic violence rate has gone up. So the COVID situation has definitely impacted what we had already been experiencing, but to a great degree.
I know isolation has been extremely difficult for many people. Fortunately, some stay-at-home orders are now starting to lift. Do you think that could help allowing people to once again have that human connection and socialize with each other in person?
Absolutely, especially with the churches reopening. And certainly when we look at mental health issues, we look at these from a biological, psychological, social, and spiritual dimension. Getting out more, number one, will help just with social connections. It's always a little different with social media, although that has been a blessing. Getting out more will help also with the spiritual connections with people, attending the sacraments, really for those of us who are Catholic and Christian, being able to be in community again. I think also what we need to be prepared for is that even though this is very, very good news that we're slowly reopening, there will be a sense of what we might call hypervigilance. We've been going these months without having touch, and I think there will be quite a bit of that still, that there will be hesitance on people's part regarding touch. There will be a certain sense of social distancing that will come as habit that will only gradually improve.
Yeah, well, Dr. Hunt, thank you so much for coming on the show. Definitely trying times for many of us. We appreciate your insight. Thank you again.
Thank you very much. God bless you.